Today, we're looking in our seventh session at this subject of healthcare mission. And these are the aims of the session: to understand God's plan for the world, seeing the big picture from God's perspective, to understand our role in it, to understand Jesus's priorities in ministry. So looking at his own ministry as he described it and what he prioritized, to understand what the global medical needs are, and also to understand how healthcare mission is changing, particularly with the challenges of the COVID pandemic and the way this is going to change mission in the future. And then, of course, the practical question of how to apply these lessons to our lives as we go forward as God's people in medicine and dentistry. So let me just tell you a little bit about my own story. First of all, my wife and I grew up in New Zealand. I trained in surgery and pediatrics, and we left with our small young family. We had two children aged 3 years and 8 months, two boys, and we went and served with the Africa Inland Mission in Kenya at this hospital in East Africa called Kapsawa back in the late 1980s. And we spent a year there, and then we went on. I did the surgery, she did the pediatrics. There were two other doctors, and then we went on to the UK. We'd planned to spend a couple of years at this missionary training college called All Nations in Hertfordshire, UK, and this was a life-changing experience for us. We shared with 170 other students altogether from 40 different countries around the world. About 10 of them were doctors, others were nurses, there were engineers, there were pilots, there were teachers. Very few of them were in full-time pastoral ministry, but they all had trades or professions, and they were planning to serve cross-culturally. And the college was called All Nations because people came from all nations, and then they went to All Nations afterwards. And that was very much our plan, was to go back to Africa, but God had other plans. He called me out of clinical medicine into student ministry with the Christian Medical Fellowship in the UK, and then I ended up doing 27 years with UK. And of course, our children are now growing up. We have 3 boys, and this is our middle boy, Ben, who is with his wife, was out in West Africa a few years ago in Liberia, and really following in our footsteps, I guess. He's now trained as a doctor. He's doing pediatrics. His wife is a GP, and this is a clinic they were running. You can see people looking in, photobombing the picture here. And so its mission has been something that's very much on the heart of our family. Let me take you back a long time before that to the Mount of Olives in the 1st century, and this is where Jesus stood with his disciples on the way to the cross before he was arrested. They gathered in the Mount of Olives here and looked back towards the city. Of course, there was no mosque there then, just the city wall. And Jesus spoke to his disciples, and he explained to them what was going to happen in the coming years between his crucifixion and his second coming. And they call this the Olivet Discourse because it was a talk that he gave on the Mount of Olives, and you can find it in Luke 21, Mark 13, and Matthew 24. And it's important that we as Christian doctors and dentists understand the times in which we live, like the men of Issachar in 1 Chronicles 12. We understand the times and we know what to do. And really, I guess this is what this talk is about. And so what did Jesus say that we could expect before his second coming? Well, he said first there would be false Christs. And so there would be lots of other religions giving alternative truths which cannot save. And of course, we look around the world today, we see that there are people who are following other religions which cannot save, because Jesus is the way, the truth, and the life, and the only way to God. But I've put the numbers on the slide: Muslims, Hindus, atheists, Buddhists, followers of Chinese and tribal religions. There's a great unfinished task for us to do. And this is where most of the big unreached people groups exist across what's called the 1040 window between 10 degrees north and 40 degrees north of the equator in this area of North Africa, Southeast Asia and South Asia. And you can see the different religions. Jesus said there would be false Christs. He said there would be wars and revolutions and rumors of wars, so news of wars in other places. And of course, we've just come from the century with the 2 world wars, and the world has never been at peace. There are wars happening everywhere now. He said there would be earthquakes and floods and other disasters. And of course, we see these. This is a Middle Eastern one, whether it's a Japanese tsunami or a Boxing Day tsunami in Southeast Asia, or the earthquake in Japan. My own country, New Zealand, has had many earthquakes. He said there would be famines, and of course often these happen in the context of war, when people are unable to plant crops or are running away from soldiers. He said too that there would be pestilences. And this is a picture of the Ebola epidemic, which happened just before my son was in West Africa. And of course, we're living through one of the greatest pandemics the world has ever seen at the moment. Jesus said all these things would happen. He said there'd be persecution. These are some Egyptian brothers who lost their lives at the hands of ISIS on the shores of the Mediterranean Sea. And there are more people dying from persecution as martyrs today than has ever happened before, many of them in Muslim countries. But Jesus said all these things would happen. He said that Jerusalem would be surrounded by armies, and perhaps never at any time in history, whether it's Hezbollah or Hamas or Al-Qaeda or Islamic State or Al-Shabaab or Boko Haram, this whole area of the world around Israel is full of armies which are hostile to the Jewish faith and to the Christian faith. Jesus said this would happen, but he also said that the gospel would be preached to all nations, starting in Jerusalem and then Judea and Samaria and to the ends of the earth. And we live at a time when we see this reality coming true in a way that's never happened before. Within ICMDA, we have 80 national associations of doctors and dentists involved in contact with Christian doctors and dentists in 120 countries around the world. And it's evidence to the way the church has grown. This is a map showing the growth of the church. The darker the color, the higher the percentage of people who would call themselves Christian believers. And you can see the 1040 window in here. But even in China, which is relatively pale, there are now more Christians in China than any other country in the world, apart from the US. And China will pass the US probably by about the year 2030. And so the gospel is growing and bearing fruit, and the church is expanding. This is the growth of Christianity in Africa, starting with 8 million believers at the turn of the last century in 1900, up to 630 million now, just exponential growth of Christianity in Africa. This is China, so up to 100 million people on the y-axis, and then the years from 1950 up to the present day. And the blue line are the Christians in China. And you can see, again, an exponential increase. No one knows quite how many, somewhere between 50 and 100 million Christians in China now. And this is the Chinese Communist Party membership, a linear increase. So we can see now that there are more Christians in China than members of the Chinese Communist Party. And so Jesus promised that the gospel would be preached in the whole world as a testimony to all nations, and then the end would come. So God is waiting for all of the people from every nation to be gathered in, and then Jesus will return. And so we can see these things being fulfilled in our lives. Now, Jesus said to his disciples in Acts 1:8 that they would receive power when the Holy Spirit came upon them, and that they'd be his witnesses in Jerusalem, Judea, and Samaria, and to the ends of the earth. And that he'd give them all authority to go and make disciples of all nations, Matthew 28:18 to 20, and that he'd be with them always. And he said as the Father sent me, so I'm sending you. And so the mission of Jesus that he exhibited to us is also the mission that he gives his people in the church. He gave to his disciples, and through them, and he gives to us as well, that we're to walk in his footsteps as the great physician. Our attitude should be the same as that of Jesus
Vocês
himself.
vendem aqui que ele aparelho para medir a glicemia? Onde?
Even though he was in the nature of God, he didn't consider equality with God something to be grasped. I think someone's got a microphone on. If you could just turn it off, that'd be great. Thanks. So we don't get the background noise. And he emptied himself and took the form of a servant, and he humbled himself and became obedient to death on a cross. And this passage in Philippians 2 begins with these words: your attitude should be the same as that of Christ Jesus. So we are to walk in his footsteps. So it asks this question, well, what was his mission? And Jesus called the 12 together, and he gave them up. Sorry, Pamela, would you be able to turn your microphone off, because we're getting a lot of background noise, Pamela? If you could just mute, that'd be great. Thanks. And so Jesus sent out the disciples to heal the sick and to proclaim the kingdom of God, to do those two things, preaching and healing together in Acts 9:1. But what I want to look at in more detail is what we call the Nazareth Manifesto that Jesus read in the synagogue at Nazareth in Luke chapter 4. And it's a good idea to go back and read that whole chapter. And these words will be familiar to you, because he went into the synagogue and he was given the scroll of the prophet Isaiah, and he found the place where these words were written in Isaiah 61. The Spirit of the Lord is upon me, because he has anointed me to preach good news to the poor, to proclaim freedom for the prisoners, recovery of sight to the blind, to release the oppressed, and to proclaim the year of the Lord's favor. Now, it said that in the synagogue, the eyes of everyone were on him, and he gave the scroll back to the attendant. And people say the reason he did was that everyone was looking at him was because the verse that he just read at the end, to proclaim the day of the Lord's favor, from Isaiah 61, goes on to say, and the day of vengeance of our God. In other words, in Isaiah, it talked about God's blessing, but also God's judgment as well. But Jesus didn't read out those words. He stopped. Why did he do this? Well, commentators say that what he was doing was signaling that there was going to be a delay between the day of salvation and the day of judgment. And the Jews didn't understand that, because they didn't understand God's mercy in delaying judgment. They didn't understand God's grace in giving salvation, or that God's plan was for all nations to be reached. They thought that God was just their God. But what Jesus was signifying was that there's going to be a long delay between his coming as death and resurrection and his second coming, the era of the church, when people would be gathered from every nation to become his people. So let's just look at that sermon in a little bit more detail. And I'd suggest to you that there are 4 threads in it altogether. Preaching, first of all, to preach good news to the poor, healing, recovery of sight to the blind. And that quote comes out of Isaiah 34, which talks about hearing to the deaf and words to the mute, and also restoration of limbs to the lame. And then deliverance, to proclaim freedom for the prisoners, and justice, to release the oppressed. So first of all, preaching, to preach good news to the poor. This was Jesus's first priority. And we hear that he walked away from places where there was still work to be done, because he needed to preach the gospel in other towns, in Jerusalem, Judea, and Samaria, and to the ends of the earth. Now, this gentleman here in the rather strange suit, his name is Smith Wigglesworth, and he was a man in the 19th century in Britain who had a wonderful healing ministry. But he said on his deathbed that he would rather see one soul saved than thousands healed, because he recognized the most important thing was for people to be reunited to God and have their sins forgiven. And Jesus said, it's no good if you gain the whole world and lose your own soul. And even though we have great gifts of healing in medicine and dentistry today, we must always remember that although Jesus healed many people, he came to empty not the hospitals primarily, but to empty the graveyards and to win people into a new heaven and a new earth. And there's much of a job still to be done. We've talked about the 1040 window here, but if you take a coin for every Muslim in the world, just consider Muslims, it would run all the way from Britain across Western and Eastern Europe, across the whole of the expanse of Russia and into Alaska. That's how many Muslims there are. So a huge job still to be done. And the number of missionaries working amongst Muslims until recent years would only have run from where I'm sitting to the back of our property, just about 20 meters away. And one of the most effective gateways to this world is doctors and dentists, because doctors and dentists can get into any communities. And then he talked about healing, recovery of sight to the blind. So the ophthalmologists get the mention, but as I said, he's quoting here from Isaiah 35 rather than Isaiah 61. And we see all of these other things here as well, a healing of the whole body. And we'll come back to this, but this is the burden of preventable and treatable disease in the world today. Public health and primary healthcare, communicable diseases, non-communicable diseases. Let's revisit that. And then he talked about deliverance, proclaim freedom for the prisoners. And of course, he was talking in part about those behind bars who were in prison, but he was also talking about those in prison to sin, who needed delivering from various things that they'd put their faith in, from drugs, from alcohol, tobacco, these things we could remind ourselves of, where many people have put their faith in something other than God, which has become a snare and a difficulty to them. And Jesus promised deliverance, and we saw him delivering people from the power of the Satan and the power of the devil. And then he talked about justice, to release the oppressed and proclaim the acceptable year of the Lord. And in talking about the acceptable year of the Lord, he was talking about the year of Jubilee in the Old Testament, when slaves were freed and land was given back and debts were repaid, where there was equality and things were evened up and justice came. And we see God's incredible passion all the way through the Old Testament and the New, to be a voice for the voiceless, to fight injustice, to show mercy and compassion. And we're going to spend a session on advocacy later in this course. And if we asked, who are the oppressed today? Who are those who can be exploited and abused? We might think of the poor. 110,000 people die every day because of poverty. It puts even the 1,500 deaths from COVID in Britain into perspective today. Or the unborn, 43 million deaths per year, babies in the womb killed by, sadly, doctors or nurses. The dependent elderly, those with dementia, refugees and asylum seekers, the victims of human trafficking. And as Mordecai said to Esther, if you remain silent at such a time as this, when you can speak, then God will raise up a rescuer from another quarter. But we want to be people, don't we, who will be a voice for the voiceless and will use the opportunities that we've been given. So there we are, the Nazareth Manifesto, preaching healing, deliverance and justice. And we now just want to focus a bit on what the global medical needs are around the world. Let's understand the times in which we live to see where the needs are. And I'd recommend this book to you, Factfulness by Hans Rosling, a very good overview. And what Rosling is saying is, if we look at the data, we see actually that in many ways, things have improved an awful lot over the last 50 years or so with the rise of modern medicine and technology, and that we have to understand that well, but there's still a lot to be done. And let's just look at some of the graphs in his book. And I've listed here on the left-hand side the things that have got better. And I have the graphs here. These are largely all health-related things. But hunger has come down between 1970 and 2010 from 28% to 11%. Of course, science articles have gone up exponentially. Harvest yields have gone up. The number of child deaths has fallen from 44% in 1800 worldwide to now just 4% in a few countries now below the age of 5. Literacy has gone up. Democracy has increased. HIV has gone down. Water supply has gone up. Smallpox has been eradicated. Of course, the spread of the internet and immunization, we're talking about the challenge for that now for COVID. So there's a lot of things that have got better. But let's think about what the global causes of deaths are around the world. And the biggest killers now are what we call non-communicable diseases, not infections worldwide. It's ischemic heart disease, strokes, chronic obstructive pulmonary disease, Alzheimer's and other dementias, various cancers, trachea, bronchus and lung, diabetes. And then we have the communicable diseases, lower respiratory infections. But it is actually, if you look at it on a worldwide basis, it's non-communicable diseases that are causing 70% of all deaths globally at the moment. So here we have the tree with the branches. And what are the roots of these, the causes of these? Well, we know that tobacco, physical inactivity, excess alcohol, and unhealthy eating, amounting to bad lifestyle choices. And so medicine is much, much more now about the prevention of disease through good lifestyle and promoting that as it is about curing existing disease. If we ask the question about disability, what are the major causes of disability? Here are the top 10. And if you look at this list, you'll notice how many of them are related to mental health. So number 1, unipolar major depression, alcohol use, number 4, bipolar disorder, 6, schizophrenia, and obsessive compulsive disorder. So 5 of those top 10 are mental health related causes. Of course, falls, iron deficiency, anemia, and so on. So let's think about what kills people, what causes disability. We're now working on the WHO's Sustainable Development Goals, which were developed after the Millennium Development Goals. And there are 17 Sustainable Development Goals. And if you look through them, none of them appear to be related to health directly. But actually, if we look at these goals, we see, and what this diagram shows is that every single one of these 17 goals has a health aspect to it. So, number 2, which is about zero hunger, it's addressing the causes and consequences of all forms of malnutrition, health related. Or life below water, supporting the restoration of fish stocks to improve safe and diversified healthy diets, and so on. So health touches every aspect of the 17 goals. Now let's just think about the world today in terms of the needs. And you'll see a lot of these graphs and maps show exactly the same pattern. So for example, this first one is the per capita expenditure on health in US dollars. And you'll see that this is actually one of the most important determinants of health, is how much is spent on health in a culture and providing preventions and cures. And of course, the countries which spend the most per capita are North America, Oceania, Western Europe and Scandinavia, principally. And those that are the least are those in sub-Saharan Africa and South Asia. This map is very similar, as I've implied. So these are the healthiest countries in the world. The darker blue, the higher the level of health indices. So again, it's North America, Western Europe, Oceania, Japan, which are right up the top. You've got a few outliers like Israel. This is maternal mortality ratio. So the number of women who die from pregnancy-related causes while pregnant or within 42 days of pregnancy termination. And you can see the darker the red, the higher the mortality. So it's sub-Saharan Africa really that is the worst here. South Asia, just a bit behind Southeast Asia. This is child mortality rate, and here it's the red, the orange, and the yellow. That is the worst. Again, it's sub-Saharan Africa, where child mortality is greatest. A few stats: 6 million children under 5 died in 2013. 4/5 of them were in Africa and South Asia. Why? These are the main reasons, and these 5 reasons: pneumonia, diarrhea, malaria, prematurity, birth asphyxia, all of these conditions are either medically preventable or curable with the resources that we have already. Mental health we've mentioned is a major cause of disability. 14% of the global burden of disease is attributed to mental health disorders, but almost up to 95% of mentally ill people in many low-income countries don't have access to the treatment that they need. Primary health care: half of the world's population still lack access to essential health services. And each year 100 million are pushed into poverty because they can't afford to pay for healthcare out of their pockets, and yet most healthcare needs can be covered by primary healthcare. Huge need for family medicine doctors who will be able to be generalists and meet those needs. Surgery: this is the global surgery edition of the Lancet magazine. Some of the statistics from it: nearly 17 million lives lost a year from conditions requiring surgical care. So some people say all we need is public health and change in lifestyle. No, we need hospitals too. I read this slide and I think in my own family of 3 people: my father, my mother, and my wife, 3 of the closest people to me, all of whom had major surgery, which gave them, in my father's case, 25 more years of life after a heart operation. My mother, 20 years after breast cancer. And you see what a huge difference surgery makes, and yet many people in the world do not have access to it, or they don't have the resources to be able to pay for it. And there's a huge need to make good surgery much more widely accessible. So let's just think about COVID for a while and what COVID has changed and what it hasn't changed. And the first thing is to remember that it hasn't changed any of these things. Man's need for the gospel, the Great Commission, the growth of God's kingdom, all these things that we've been talking about, the call to preach and heal. It hasn't changed the fact that Jesus is coming back, that judgment is certain, and that a new heaven and a new earth is coming. In fact, God knew about COVID. He is sovereign over COVID. He's working through COVID, and he's absolutely in control of the world. COVID hasn't changed any of these things, but what it has done, it has changed the way that we're doing mission. And these are patterns of healthcare we're seeing now, which COVID is going to speed up, because we're moving from a colonial West to the rest model, where people come from Europe and North America to go everywhere. Mission is now from everywhere to everywhere. Every country is potentially a sending country for missionaries. A move from curative hospital-centered to preventive community-centered, recognizing that with non-communicable diseases, it's prevention that's very important. From paternalism, doing things for people or to people, to partnership, doing things with people across cultures, across nations. From full-time church planters, pastors and evangelists to tent makers. Paul was a tent maker who made tents to raise income to support himself to do his Christian work. And now many parts of the world, you can only get in as a professional or a tradesperson, as a doctor or a dentist. It's going to be people like us who are the future missionaries. From university trained professionals to lay workers, from pioneering in new areas to working within secular systems. There's still a huge job for mission hospitals, for example, but many Christians can now be salt and light in working for multinational corporations or national health services, getting into countries. And so this is the principle: give a man a fish and you feed him for a day, teach a man how to fish, you feed him for a lifetime. And the training of health professionals is a huge priority for ICMDA. And we think going forward, it's one of the main things that we will be doing is making it possible through things like the Family Medicine Training Program for people to get training. And there are many opportunities for Christian doctors and dentists to be doing teaching and training, whether it's in medical and dental schools and centers of excellence, in like hospitals, mission hospitals, whether it's through distance education like the Family Medicine Training course. Lots of opportunities. This is a university in North Korea, and the students are the sons and daughters of the members of the Communist Party, the most closed country on earth. But you can get into this country as a doctor or a dentist and teach at this medical school. And there are many Christians in there. So God has provided a door into even this closed country through medicine and dentistry. Just some more examples. The Pan-African Academy of Christian Surgeons has trained 100 African surgeons in the last 10 years, all of whom are still working in Africa. And they're all trained to the level of a board certified surgeon in the United States with incredible skills and great abilities, because so many people in Africa are still in need of surgical care, 56 million people. This is our family medicine training course. It's been running for a year now, coming up to, and we're taking a new intake in May of this year. Some people, in fact, some people on this call even are doing this family medicine training course over 2 years. 30 students from 15 countries, a 2-year course which you can do in your hospital or in your community through distance learning. You don't have to be going to a school to do it, and scholarships are provided for people. Prime is an organization which trains in medical education around the world. It's based in the UK, training people to have those skills. And of course, many famous missionary doctors have gone before. David Livingstone, James Hudson Taylor, who opened up Africa and China, Helen Roseveare, who worked in the Democratic Republic of Congo at the time of the rebellion there. And God has used doctors and dentists in many different situations. There are almost 2,000 mission hospitals still in the world today where Christian doctors and dentists are working. C.T. Studd was a famous cricket player from Britain, but he left everything, and including a big fortune. It was a very rich family, and he went to China as a missionary and set up the World Evangelism Crusade. He later served in India and in Africa, where he died. And C.T. Studd said, if Jesus Christ is God and died for me, then no sacrifice can be too great for me to make for him. That's a wonderful testimony. And so what do we make of all this as we look at it? Well, I think that what we have to ask ourselves is, where is the need, first of all, and am I called to stay where I am? And we live in a world now, and when COVID lifts and travel is possible again, we live in a world which will be very accessible to us in terms of travel. And where we are blessed with skills of medicine and dentistry, we've got to be thinking in terms of, where could God use me most of all? Don't be prepared to go, but actually planning to stay. Prepared to go, that's how it was put to us. And it was really the start of our adventure when we first went to Africa. So how do we prepare for a world where there is such great need and where we have skills that can be of such use? Well, we need to get tough by being ready to serve in hard places, by longing to make a difference, by being prepared to go where God might call us. We need to work hard to get the necessary training, not just in medicine and dentistry, but in language learning, cultural awareness, and we need to count the cost to be able to say, God, work on my character so that I can hear your voice, so that I want to walk in your footsteps, to be in this work of preaching, healing, deliverance, and justice. When Isaiah went into the temple, he saw this vision of God, and God spoke to him, and he looked around and saw the world in great need, and God said to him, who shall I send and who will go? And he said, here I am, send me. And when we think about what Jesus has done for each one of us and bring us into his kingdom and in saving us and the many blessings that are coming in the future, then is there any other response but here I am, send me? What could you do with me? How can I serve you and bring glory to you? So there we are. That's a very quick overview of healthcare mission and the needs today, looking at the start at what Jesus said would happen in the days between his resurrection and his second coming, and seeing how all these things are happening in the world by looking at his mission of preaching, healing, deliverance, and justice on the Nazareth Manifesto of Luke chapter 4, and then a look at medical needs. What is it that people are dying from that are making people disabled? The rise of the non-communicable diseases, the fact that COVID has not changed the Great Commission, and also the way that mission is changing, and how there's a great need now for teaching and training of others and multiplying workers, but realizing that medicine and dentistry are great gateways into countries which are closed to other forms of missionary work, that doctors and dentists can go where many other people cannot.